from literally within walking distance. How amazing is that when you think about it? Is Danielle Matthews, otherwise from here on out known as Mom, and Makayla. Makayla, how old are you?
13.
13. Okay. We'll start with your mom, if you don't mind, Makayla. Danielle, tell us about what was going on in your lives in the Matthews family, January 26, 2013. What was happening back in January of 2013?
Nothing too much. We were, she was in the middle of exams. I'm a teacher at Heritage Christian Schools. We were doing exams that week, and she said she didn't feel good on a Wednesday. And I said, if you feel bad, just let me know. I'll come take you home. And then Thursday, she ended up staying home. She didn't feel well. We took her to the doctor, thought maybe she had mono or strep or something, tested for those, negative, ended up still feeling bad, stayed home on Friday, ended up calling the doctor again. He thought maybe she might have pneumonia. So went for a scan, x-ray on Friday, negative. And Saturday, called the doctor again because she spiked a fever of 102.9. It got up to 104.6.
Wow.
I couldn't get it down, and we were alternating Tylenol and ibuprofen. The doctor on call with her in her group didn't know the whole story, but said, do some tepid water, get that fever down, keep doing ibuprofen and Tylenol. And we, by that evening, she was taking another tepid water bath, and I thought it was bizarre because she could not literally get out of the bathtub and put her clothes on. She had to lay down on the floor to do that, and I'm like, okay, let's get you in the bed. So maybe 2 hours after that, I checked on her again, and she literally was having a hard time breathing. I've heard that sound before. It's a gurgling sound
Wow.
as you breathe. And my mom has had issues with her lungs as well, and I recognize that sound, and I'm like, we've got to go to Children's. Did not know that it was that bad when she walked in the door, and literally I barely could get her down the stairs from her room. My husband and I, we didn't carry her. She walked on her own, but she was leaning on us. Her oxygen sat levels were 53 when she walked in the door.
Oh, my God. So you walk in the door, and from that moment forward, what happened here?
Well, they rushed her in the ER back to a room, and they tried to put oxygen on her, tried to get her sat levels up, wasn't working. They said that they needed to intubate her to try to get her sat levels up. They did that, and then they called a code on her. Because they apparently had some other people coming in and they wanted her to be first. But then at that point, I've never seen anything like it. It was like so real. There were 20 doctors and nurses all over her trying to get her sat levels up.
So ultimately, what did they tell you? What was wrong with her?
They didn't know. They didn't know at that time, other than she had very little oxygen in her body.
But we do know that they work and work and work until they do come up with a solution to the situation, the diagnosis. So when did the diagnosis come?
She ended up going up to 5, and they came and basically kept working. It was, I think, it felt like hours, because you're in a state of panic at that point as a parent. The doctor finally, through the social worker, we finally got back to see the doctor on 5, Dr. Hansen, and I can vividly remember it. She was sweating, and she said, we're working as hard as we can, but we're going to have to put her on ECMO, and it has risks. But that's the only way that they could see her surviving.
Now, explain to people what ECMO is.
It's extracorporeal membrane something.
Yeah, and you're a mom, so did you know right away what that was?
No, I had no idea.
So did they say to you, here's what the ECMO machine is?
Right. It's basically heart-lung bypass that, like, heart patients are on when they have heart surgery.
And this came out of nowhere?
Yep. Mm-hmm.
So she just wasn't feeling well, and then... Okay, so what was the official diagnosis?
The official diagnosis after lab tests and all that was MRSA pneumonia, influenza B, and then she became septic.
How does that happen? I mean,
Still asking that question, right?
I mean, that's the $1,000,000 question. You just sit there and you think, how in the world did my child get that?
How long were you guys in the intensive care unit?
We were there the whole time, 3 months.
3 months.
Mm-hmm.
So from the time that you were able to coax her out of her bed to lean on you and your husband to bring her in here, 3 months.
Do you remember, Makayla? What do you remember?
I remember like going into the hospital and like just having all this panic in my mind and stuff, and then like I was out for a while, and so, but I would like come back and forth a teeny bit and like see what was around me.
Was it just really hard to breathe? It was really hard to get air?
Yeah.
Yeah. And how are you feeling now? What are the after effects of this?
I'm a lot better. I recently had just gotten off oxygen and stuff. So, I've been improving a lot. So.
Okay, so you recently just got off of the oxygen.
How are your lungs?
They're good.
They're good?
Mm-hmm.
Did they suffer any permanent damage?
They have permanent damage, but like they're getting better.
Okay,
like regenerating or whatever.
Yeah, maybe.
Maybe. Okay, what do they tell you, Mom?
She's lucky to be alive, actually.
Mm-hmm.
Most kids that come in with MRSA either don't make it, or they being on ECMO alone has risks of brain bleed, that kind of thing. And it's amazing how she doesn't have any of that. She did have a stroke. Where oxygen wasn't allowed to go to one part of her brain, and so her whole left side was weak, and we've had to go through learning how to walk again, learning how to use that left side, and having feeling in it. But other than that, she does have what we call chronic lung disease from it. If you look at her lung x-rays, she does have whiteness, which is not a good thing. You want to have black on your lungs because that means they're clear. And she definitely does inhalers and things like that. Exercise, activity, we're still working on trying to get back. She right before all this happened, she was a soccer player on a select team in here in Tosa, and she loved doing that, but at this point she's not back physically to that.
Talk to the people out there about the experience with these doctors and these nurses and these caregivers and just the overall facility that is known as Children's Hospital of Wisconsin, and how they helped you deal with what was going on with her.
They were very honest and said that she was very sick, and basically they did not know if she was going to make it, but they were going to try as hard as they could to get, to do as much as they could to make it be a positive outcome. You hear things after the fact, like I did not realize that when she was on 5 trying to get the ECMO in, that the general surgery had a hard time, couldn't get it in. So then they called Dr. Woods, who is the cardiology surgeon that came in and got it in. And I'm like, and he did most of her surgery. She had to have 4 thoracotomies to repair her lung damage. But it was amazing when you hear that behind the scenes, all that is going on. And like Dr. Ghanayem, who is part of the head of West 3, which is the cardiology, she had to be on that floor because of the ECMO thing. She would keep in touch with Frater because she was a bigger child. And they ended up doing procedures that they haven't done. Like she had one lung had one problem and another lung had another problem, and they ended up putting what they call a double lumen tube, which they put 2 ventilators on her, both doing 2 different things, and that normally doesn't happen. So, and plus the whole blood thing, she kept bleeding out because of her lungs having trauma, and I've never seen, where they just they get the blood, and I'm like, this is so important to give blood as well.
I was gonna talk to you about, or ask you about, what it's like to go from, you just said Makayla was a select soccer player. So if you go back a month or 2 before this, being here and having to deal with what you had to deal with is the furthest thing from your mind.
Absolutely.
A 180-degree change in your mindset. And I think there are a lot of parents out there who really don't ever think that they're going to need Children's Hospital. Their kids are healthy, and we talk about this all the time. Like when you think of children's, I don't know why, but you think of little ones. You think of really little ones, and you think when your kids get to a certain age that you're kind of safe. but that's really not the case.
No, I agree with you 100%. You never think it's going to happen to you. When it does, you're at a loss at how to handle it. The staff here, the people they have in place, like child life specialists. I have another daughter that is 2 years younger than Makayla, and it was like a whole world upside down. And the child life specialist totally, when you have a child that's hooked up to every machine possible, and she wants to see her sister, and you're not quite sure how that's going to work. In her mindset, the child life specialist was amazing. She did a little book together for her to explain everything, and then she actually went in with all of us to see her when Makayla was still out. It was amazing, and the great part about that is this affects everybody in your life because she's in school. Because I'm a teacher at the school at Heritage Christian. The child life specialist made a book for her class, which was great for the kids to understand what was going on.
Wow.
Well, and here's the thing, is that if this facility hadn't been here, who knows what could have possibly happened? You live in Tosa. It's right here. Mm-hmm. It's right in your own backyard. We say it all the time that there are people that would bring, take your kid anywhere, but time was of the essence, especially in this particular situation. So how lucky that you could just go a few blocks and be right where you needed to be.
And the other amazing miracle is that this facility has the ECMO machine. Not very many facilities have that, and those things are very expensive. And to my knowledge, we have 4, and Makayla went through a couple of them because they had to keep changing them out because of clotting issues and things like that.
Makayla, how much time do you still come back to the hospital?
Yes, I come back for some physical therapy and just appointments.
Okay.
And then in summer, I came back for just a few days because I had some sort of pneumonia again. But,
do you like your caregivers?
Yeah.
Are they nice?
Mm-hmm.
And you're not just saying that because they're all sitting watching you, right? Which I think is fascinating. That's something we don't really refer to, but the support staff is so great here in the sense that when I say support staff, I mean that these are all the caregivers who have not just helped mend you physically, but emotionally they support you, and they are your support staff. And so many, I would say virtually every one of our patients
has a cheerleading squad behind them.
Squad sitting behind them, because they have such a vested interest in your well-being, and they want to make sure that not only do you do well when you're here, you even do well when you're on the radio. That's what they're here for. They're here to support you emotionally in every aspect. Thank you so much for sharing your story. We really appreciate it.
Thank you.
And the story of Makayla, unfortunately, is not unique in the sense that you've got a family who, is going along, living their life, everything is fine, and then their world gets turned upside down, really. And Makayla is indeed lucky to be alive, and we're all lucky to have Children's Hospital right here in literally our backyard, if you want to call it that. We've talked to parents and families who have come from all over the world, and how cool is it that it's right here in southeastern Wisconsin. Children's Hospital of Wisconsin, consistently ranked among the top children's hospitals in the entire world, and on the cover of Time magazine this week because of their expertise in the NIC unit. You can buy that on the newsstands tomorrow. You can read the article if you want to go to our Facebook page. And if you want to donate money, the Durzon and Menard phone bank is 414-337-9554. And what we're going to do right now is for the next 15 minutes, Kohl's Cares. It's a Kohl's Power Burst. So thanks to Kohl's, they will match your donation dollar for dollar. So whatever you can afford to donate. And if you can do the $25 a month, that'd be awesome. But if you can't, it doesn't matter what you can donate.
No,
they'll double it.
Anything is graciously taken. And once again, we get the question all the time: what does the money go for? What does the money get used for? Well, ECMO. How about that? Let's just say ECMO. We've got 4 of them here. We've just been told that not every hospital has one of those machines, and Makayla might not be here if they didn't have them. We got 4, so there. And
if you want to donate online, I do want to remind you too that doubling your money thing works on our website as well. So thanks to Kohl's Cares for that. Go to WKLH.com, but make these phones ring. Make your money really, really count. You can double your money right now. Call the Durzon and Menard phone bank, 414-337-9554.